Support at the Cavern is an out-of-hours mental health drop-in based in the Cavern, which is a coffee shop in Gloucester city centre. So this is the Cavern coffee shop. When people come in each evening, they're able to get a cup of coffee and enjoy being part of the family here. We find that talking over a coffee is a very normalising experience for people. It's something that we do all the time with friends in coffee shops. And so again, it removes barriers. It helps us to connect very quickly on a deeper level. And for the price of a cup of coffee, it does a huge amount in building relationship and in helping to engage people far more quickly. We see up to 60 people a night here at the Cavern. We have over 680 people now registered to use the service. It's open from 6 o'clock in the evening until 11 o'clock and is open 365 days a year. The Cavern really is there to complement the existing clinical services. We offer a broader range of support than clinical services are often able to, particularly in that out-of-hours period. So we help people with their emotional well-being and their social well-being in particular. We have lots of peer support going on every evening. We offer a listening service for people. So we don't offer clinical treatment, but we're there to provide people with a safe space to go. In here is where we hold a lot of the mental health drop-in. We've focused very much on environment. Environment for us is half the battle, really, in terms of building trust and in terms of making people feel safe and comfortable. If we can achieve that, then it means we can spend a lot more time engaging with people on a deeper level than we would otherwise be able to. Support at the Cavern was funded by Gloucestershire CCG, and that's really helped us to ensure really cohesive links with other health organisations. So we're on the MIDOS system for 111 calls, so people can call 111 and be signposted to us. We're on the ambulance referral system for the South West Ambulance Service. We also have links with our local mental health trust and work closely with them, particularly around individuals who are of particular concern at any given time. We also work with our local crisis teams, and so we contact them when we need support, and they're able to contact us if they want to refer someone to us. A&E often signpost individuals to us, particularly those who frequently attend, but their needs are more social or more emotional, less clinical. We're on our local GP network, which means that GPs can find information about us on their computers whilst they're in consultations with people who might benefit from our service. The Police and Crime Commissioner has funded some workshops so that we can run arts workshops, music workshops and singing workshops, so that people can try and reconnect with perhaps old passions and things that they might have done previously but have lost the joy out of or forgotten that were there. So this room is often used in the evenings for some of the additional activities, such as the ukulele workshops, the singing workshops, and we use it for other support groups that we might well have. It's a really community-based approach. Community is at its heart. And this is reflected in our staff team that we have. So we have 3 staff each evening at support at the Cavern. We also have a team of volunteers. But our staff aren't clinically trained. They're not mental health professionals. They're people who can listen and who can support others, but they're people who care about people.
We regularly have people saying that they would have been calling the crisis teams, or they would have been going to A&E, or they just wouldn't have coped, whether that would have been kind of self-harming or attempting suicide or any of those kind of things. People regularly say, actually, this changed their evening, and just being a part of something. And sometimes we don't even have to have a particularly deep conversation. It just gives them that sense of belonging somewhere and a bit of a distraction as well.
I come to the Cavern because it gets me out of my house because I spend a lot of time indoors. You know, it's a non-judgmental atmosphere. You know, there's staff here I can talk to, and they'll just listen on. Doesn't matter what I have to say. It's a great place to sort of meet new friends. I would say coming to support at the Cavern, it's, you know, I could just drop in whenever I want.
My life is on the line. Suicidal. I couldn't cope with things. Coming here gave me a new breed of life. Made me feel that people care, and they do care a lot. And they look after you well here. And you can't fault any of the staff at all. It's absolutely brilliant.
I volunteer because it gets my confidence up and makes me more friends. Yeah, I met a lot of people when I was here. Like, my life was not very good. I had a big problem with my mum and I moved here, and I never used to get out a lot till I find about the Cavern, and then it gets me out. The Cavern is very friendly. We're all like family, and it's very welcome, and it's always good to talk to people and we just have fun. And the staff is very nice as well.
I feel like I've learnt so much being part of it. I feel like I probably get as much out of it as the people who come. But being able to work with people who so often feel like they've been written off, and just because life is hard and so many different factors, and discovering that within each of those kind of, whether it's a stereotype or a label that they feel they've been given, within each of those people, there are such amazing people. I think I'm blown away by that kind of nearly every night. Just the conversations you have and the hearts and the passions that you discover within people. And whether or not kind of they make massive steps forwards, just being able to see that in someone and acknowledge that and have a chance to get to know them is an incredible privilege.